Periodontal disease is an inflammatory disease present in the gums around your teeth. It happens to about 3/4 of the people statistically, although it's probably higher than that in the population. It's caused by bacteria left on the teeth, and people respond to it differently based on several different factors like their diet and genetics. Some people are more susceptible to gum disease than others. We'll call it gum disease as periodontal disease. So if you have a history of family periodontitis, there's a chance that you might be susceptible to it as well. So if that's the case, then you might have to be a little bit more diligent and more careful about how you take care of your teeth. Most people, we can take care of their periodontal disease if we catch it early and get on it right away, and if the patient is very compliant in doing what we ask them to do, and with some of our newer techniques that we use here in this office, we have very gentle, very effective ways of getting periodontal disease under control. We use various solutions, some very high-tech instrumentation that we use, piezoelectric handpieces, things like that that don't bother your teeth, they don't pound on you, they don't bother your gums. We use topical anesthetics that are extremely effective. And anything else that you might require to help you get through it. We do things like oral DNA testing to test not your DNA, but the DNA of the bacteria that might be in your mouth. So with our regimen that we've been using lately, we will treat somebody with these newer techniques for a period of time and get as much resolution of the bleeding, which is the primary sign that we're looking for, and pocket depth around between the tooth and the gum. We use those two as our main parameters. Once we've gotten as much of resolution of the periodontal disease as we can, but we still have a little bit of bleeding, or still an area here or there that doesn't seem to want to heal, then we will do a swish and spit, and then we'll send that off to the lab, and a week later they'll come back with results that'll give you a quantitative and a qualitative analysis of the bacteria that are in your mouth. It turns out that if you have gum disease, you are susceptible to having various medical problems to the tune of about 3 times. So if you have gum disease, you're 3 times greater at risk of having cardiovascular problems, including strokes, heart attack, diabetes, asthma, rheumatoid arthritis, Alzheimer's disease. They found the bacteria that are involved in gum disease, called spirochetes, are involved in the brains of people with Alzheimer's. You're at risk of higher blood pressure, premature delivery, low birth weight, and some cancers, and probably other things as well. So it's a good question, and it's something that if you're really diligent about and do the things that we ask you to do, there's a very good chance that you can get it under control.
Wow. Well, thank you, doctor. Appreciate that. And definitely will be going to see you about that, because I have some, and you kind of let me know what all the risks are, so thank you.
Also, I might add, if we find out from the oral DNA test that you have a specific type of bacteria, that test will also give us a regimen of antibiotic therapy, or that we can choose from. We don't have to do it, but it's a recommendation. And so sometimes we will give that antibiotic, recommend that for you, because some of the bacteria that we find increase your risk of cardiovascular events by 13 times.
Wow.
So anyway, that seems to take care of it.
Oh, that was very eye-opening. Thank you.